to have Dr. Sarver on as my co-host today. We've got a great call scheduled today, and we're talking about the value of understanding toxicities and deficiencies, and to see if what's going on is something that we need to pay attention to. So, Dr. Sarver, welcome to the call. Great to have you on here.
Thank you.
So Dr. Sarver's driving. He takes care of patients all over the state. So when you're the best, that's what happens. So he's got patients in Grand Rapids, patients in Flat Rock, patients in Ann Arbor, and so he's a highway warrior. He's all over the place on that. For those of you that are joining live, know that we are streaming this live on our social media channels on Facebook, on YouTube. And so if you want your name edited so that your full name isn't showing on there, you're certainly welcome to do that. You would just click on your name in the participant screen. If you have questions throughout the call on the participant screen, you can click the blue hand button, which will raise your hand, and then we will get to calls in a little bit. So Dr. Sarver, everybody in the whole world that we know listens to one radio station. That radio station is WIIFM. What's in it for me? And so I just want to start by asking you why people need to be paying attention to whether or not they have toxicities, whether or not they have deficiencies, whether or not they need the master level service that you provide. Why should somebody listen to you, and why should somebody consider your services?
We live in a world, as most of you are aware, that is not as pure and natural as it was when our grandparents grew up. And before then, even it was even more pure. So we live in first of all, a toxic environment, not only what we breathe and what we put on our bodies, but the things that are put on our foods and the soils that our foods are grown in. So our number one reason is to allow the body to function at its fullest potential. And one of the things that sets NRT apart, what the specific modality that I use, is the ability for us to fine tune and pinpoint toxicities, whether they're coming from foods, air, water, the environment that we're in, and we can tell the patient specifically what it is. And then once we find that, we're able to use a variety of different detoxodes and match that up to that specific patient. And then once we put the fire out, so to speak, we want to bring in the carpentry crews. So we want to remove the interferences. So that can be in the form of toxins, as I said, or it can be in the form of immune challenges like fungal overgrowth in the gut, which, as a lot of you have heard of, leaky gut syndrome. So that can get into the brain, that syndrome, and allow the toxicities from all the above to enter our brain, our nervous system. And so this is really closely connected with Dr. Lazar's work. So we want us to be fully functional in all the paradigms of our health. So the nutritional response testing, as I said, brings up into the microscope, so to speak, of the analysis, what has gone on recently to toxify our systems and what's gone on maybe even 3 or 4 decades ago. And so we bring more and more of that body into where it should be when we were designed way back, whatever our age was. So then once we bring in that cleanup mechanism, we're able to help the body take the brakes off. So it's like we're going down the road with our foot on the gas and brake when we have toxins in our system. So that alone really is remarkable in what it does to patient symptomatology. Of course, we're not just treating symptoms. We want to get to the cause. But a lot of the patients that we see are really amazed at how just removing toxins from their systems really allows their systems and their bodies to see improvement in how they sleep, and their energy or skin irritations, etc., disappear in a quite fast, easy, remarkable way. But what we want to do is store at a deeper level. So we're bringing in the natural, original equipment, building blocks that God intended for our bodies to have. So we match up what the kidney or the liver or the pancreas, whatever the deficiency or the weakness is, that we've determined from a whole body analysis, the testing, the labs, etc. We want to see the whole orchestra functioning. Orchestra, I mean every cell in your body has a different energy, has a different function. But we look at it, first of all, as more of an organ synthesis. So we're looking to balance maybe what the adrenals are doing to the hormonal function, or the hypothalamus, what that's doing with that patient's overall sleep, etc. So it's a lot more simple. It's better always felt than telt, I always like to say, because patients will just be very confused when I just talk about. So the actual hands-on testing is always the most efficient way to convey the whole message and the whole picture of NRT and what I do.
So let me ask you this regarding the testing. So if I'm talking to you, and I know because of background training that the fuel we put in our cars is important, and the fuel we put in our bodies is important. We know, and as a society, we know that the food we eat matters, whether it's nutrient dense or nutrient poor, whether we're getting enough of the good stuff, whether we've got too much of the bad stuff. And I want to share a couple stories just so people can latch on, because while everybody understands that proper nutrition is important for them, it's also really important for people to understand who it's most important for. Like if we were to prioritize, hey, if this is you, this is the red, yellow, green. Red means stop what you're doing. This needs to be your next phone call. Yellow means, hey, this should happen pretty soon. And green means, hey, it's hard to repair in the future, so let's get on it when we can, but it's not super life grabbing at this point. I think it's important for people to understand that. But what I want to share is through my own care, through my own NRT or nutrition response testing care, the work that you do was able to find that I had cadmium toxicity in the frontal lobe of my brain from when my mom smoked when she was pregnant for me. For my daughter, the work you do was able to discover the reason she was having headaches was because she was exposed to juniper bushes, and we had just planted juniper around our pool and then had to remove those, and then Jaden's headaches went away. And my wife had thyroid symptoms that her MD wanted to put her on medication to lower her thyroid function because her lab work showed that she had too much free T3 and T4 in her blood, yet her symptoms were that of hypothyroidism, where she was losing hair and weight loss resistant. And so, her MD looked at her lab work only and said, oh, we need to bring these down. Well, through the work that you do, what was discovered was she had been exposed to formaldehyde after the purchase of a new car that shut down her pituitary gland, and her pituitary gland was not regulating her thyroid gland. And had she gone the route she was advised to go, she would never have gotten better. Yet in a matter of days, which doesn't always happen, I don't want to overpitch, but in a matter of days, she was waking up again before her alarm clock. Her thyroid gland started functioning more normally. And so I think about these things, and it's true. I do think that everybody needs to be tested. And we believe that the foundation of nervous system function is key. If the computer's not working, the whole thing's not going to work. And then we want to layer that with the proper stuff in and get the bad stuff out. Who listening to this, either live or as a replay through one of our channels, who listening to this needs to stop what they're doing and schedule an appointment with you, who would you be talking to in that context?
Well, America has been programmed, and our generation going back even further than just our generation to symptom care. So I really think that anybody is a candidate to at least get checked, because a lot of times disease or dis-ease or something that is silently developing over a decade before the symptoms appear, or several decades even in some cases. So what we can discover now is going to really save that patient not only the cost of their well-being and their cost in their pocketbook, but they're going to save themselves going down a lot of different rabbit trails if we can get the whole body back to where it should be before it goes too far out of the lane that it's in, that it's supposed to be in.
So you're saying, okay, so what do you say to the people who say, well, my thyroid gland, I had the blood work, but my thyroid gland is working fine. So I'm fine.
But number one, the blood work that they have may not be complete enough. And what we're looking at is usually a lot broader workup. So, for instance, our basic thyroid screen is getting 6 different levels of thyroid function. We're
Yours,
also, yes, we're
your
getting
custom one, or the one they can get from their other doctor?
well, the one that we're getting through our office.
Oh, okay.
And then their other doctor, a lot of times all they're getting is one level called a TSH, which is really reflective of the pituitary gland, as you reflected about your wife. So, and then when we look at those numbers, we're looking at a functional level. All of the paradigms are different. All of the levels are much narrower in our world, in my world, because we want to prevent. We want to have them in that optimum sweet spot so they don't develop the need for a drug. Once they get outside of the broad range that is in the medical world, then the medical doctor is saying, aha, you're not telling me things that are all in your head. You're not imagining this anymore, which a lot of patients are. They're being told, yeah, you really don't have it. It's something else. We'll send you to another specialist. And they go on this merry-go-round until finally their thyroid gets so bad that they're prescribed the drug. So we're able to see and identify things before the symptomatology happens, or even like with your wife, some of the symptoms are hair falling out, the low energy, the sleep issues, etc., will resolve much earlier, and we'll see those patterns much earlier when we see the whole picture and we look at it in the functional world, along with the muscle testing work of NRT. We're able to really fine tune and hone in on the exact causes of the problems.
So one of the things I think that's really important to point out is, right now there are a lot of moms who are homeschooling, who are crisis schooling because they weren't planning on homeschooling. That wasn't their plan. Yet they find themselves in this situation where they're having to crisis school, where they're having to homeschool, and they just weren't planning on that. But here they are, and they're exhausted. They're not functioning well. Now, in a perfect world, we would be tested before before things have really developed and before it's too late and before we're repairing. But sometimes in our society, people are conditioned to wait until a crisis and then ask for help through an intervention model. And that's fine if that's what they choose to do. But for those people that are interested in a non-interference model, we're checking nervous system function, we're checking spine function, we're checking blood flow. You have the most robust panel of lab work I've ever seen. And it's really neat to see the data that you get on all of these patients, which is just remarkable. And I actually would go so far to say I think this is a missing piece in our healthcare. it certainly is missing in disease care. And the fact that you're introducing this in Ann Arbor as such a phenomenal healthcare option, I think it's great. Now, just logistically, before we open it up for any sort of questions, um, I just want to mention that for patients that are not yet patients of Lazar Spinal Care, the cost of this custom lab panel and the testing that you do, the one-on-one testing that you do, the cost for that is $497. Completely worth it when you see the amount of data that people are that you're getting on people. 497 is remarkable. By the way, I've got a buddy that's a plastic surgeon, and he charges $750 for a consultation. That's not any sort of testing, that's not any sort of lab work, that's not any sort of procedure, but to consult with him, to meet with him and talk to him for 10 minutes time, $750. What this is for you, 497 is the lab work, and then you are actually testing them, analyzing their results, correlating the data, and then meeting with them on a second visit to go over what those findings are. And that portion is all 497. If you're an existing patient in our office, we always want for you to have, you know, first access, right? Before his schedule is completely full. And so during the month of October, the appointment must happen during the month of October. And you must be an existing patient at Lazar Spinal Care. That same testing we talked about, you've offered to existing patients in the month of October for 297, which is remarkable. I think that's very generous of you to do that. So if you're watching this live and you're able to get in October, we've already had to add days, which is a really great problem to have. But I know those appointments are running out, and when those 297 appointments are gone, they're gone. It's totally worth the 497, so no need to rush. But if you want to save a couple $100, definitely try to get on Dr. Sarver's schedule in October. Why don't you share one of your greatest wins, Dr. Sarver, and then we'll open it up for some questions for our live people. And I'm going to turn my head and scroll through some of the social media stuff and see if there are questions on there. But go ahead and share any win
Sure.
that.
Sure. I just wanted to back up on the labs for just a second.
Sure.
A lot of the medical doctors' labs are based on what the insurance model is looking like. So that's why they don't have a lot of completeness. So their ordering has a lot of holes in what we need to really see a full functional blood chemistry. So I've seen labs come in that patients were told were complete, which were about a third of what I order in the labs that we're doing. So when Dr. Lazar talks about these labs being really extensive, they are, believe me. So one of the biggest wins that we've seen, I had a patient that had a severe leg ulcer. In fact, it went up all the way to her knee from her ankle, oozing and letting out pus, extremely swollen legs. Whenever she stood, it was very, very extremely painful. So working with us, and she was told by her family and everybody around her, go to emergency, and she believed in nutrition so much of what we did that, she went through the program, she stuck with it, and she has pictures on her cell phone, and that's one of the biggest testimonials that she shares with all of her family and loved ones. And I can say with confidence she's referred at least, I would say, 50, 60 patients in the last couple of years to us just because of the remarkable recovery. Her legs looked like they were at the point of almost being amputated. They were so bad. I mean, she came in wrapped in bandages, and she'd take those off, and they were oozing, and they were really, really scary to look at. But she had such faith in the body's ability to heal itself if we remove the toxicities, the interferences, whether they're from the inside, the outside, or fungal overgrowth, or whatever it was. and the body's ability to take the natural tools that we have in the whole food supplements, the homeopathics, etc., to heal those legs. And I'm amazed sometimes at the belief system and the tenacity of our wonderful patients. They get how the body is designed. We have the biggest healer within our systems if we give the healer the innate intelligence, or the actual doctors within us, the tools, the natural killer cells, the lymphocytes, the phagocytes, all of the T cells, etc., that God gave us to heal. But in our world, we've dumbed it down so much, and we're chasing symptoms, and we're going from one specialist to another. But when my patients, like this patient, totally believes and gets it, they have remarkable recoveries, and it makes me so excited. Another patient, one of the biggest wins, I just wanted to add this one in real quickly. The guy came in with a operable, he was told he needed an aneurysm surgery on his abdominal aorta. And his wife was so convinced that I could help him. And at the time, I'm thinking within myself, can this guy's aneurysm really be healed? But I said, yeah, sure, let's see what will happen. Let's do what we do. And a few weeks later, she came in and she had tears in her eyes. They had gone for a follow-up MRI, and she said the aneurysm is no longer visible. He had lost about 40 pounds in the meantime. He had stuck with the program, and what really happened was his body got rid of the inflammation at step one, and then his body sent in the repair crew to repair that blood vessel, and remarkable. It wasn't visible where it was in the first study. The second study showed that his aorta had cleared up and was fully functional once again. Brings goosebumps to me every time I talk about it.
That's so powerful. We're running short on time. I want to get to questions. I appreciate you sharing that. Miss Cheryl, I see your question. Go ahead and unmute, and we'd love to get to your question.
Thank you. Hi, Dr. Lazar and Dr. Sarver. So when a patient is on medications, prescription or over the counter, do you work alongside with their general practitioner, and even do you help them kind of get off of these medications?
Absolutely. Probably the majority of our patients do have some sort of medication that they are on. And our job is not to necessarily take them off any medication, but to allow the body to function so that they don't need the medication. So we can work in tandem with their medical doctor, and then the medical doctor has no choice but to reduce the medication once they see that the indices, the reasons why they put the patient on the medication, for instance, they had blood cholesterol or LDL or what, triglycerides, whatever it may be, is improved quite a bit. Then the patient can say to the doc, hey, do I need to take the statin drug, or can I reduce the statin drug, or whatever the drug may be? So that's definitely what we see all the time and what we can work with. And my job is never to tell a patient, you must go off of a drug. I just let the patient and the whole healing response take place, and then it becomes a no-brainer at one point.
Good, thank you.
That's a great question.
Welcome.
That's a very good question. Yeah, and as far as if somebody is taking blood pressure medication, for example, because they're taking a beta blocker because their blood pressure is too high, and we get the pressure off their brainstem, if it's a neurological high blood pressure, oftentimes, and that's well researched, oftentimes the blood pressure will go down. Well, if somebody's taking a beta blocker and their blood pressure naturally normalizes, the beta blocker will actually be harming them because it'll be taking the blood pressure too low, and then people can pass out. And so we know to look for that. I know Dr. Sarver knows to look for those things. And so it's not within the scope of our licenses to give medication advice. But what's really fun about it is if somebody's taking Adderall and now they can focus, they go, hey, wait a minute, I think I don't need to take the Adderall. Or if their blood pressure normalizes, they say, I don't think I need to take this. Or when their migraines go away, they say, I don't think I need this Imitrex anymore. So it becomes this really cool thing, because when your body is working as designed, we don't have high blood pressure because we have a beta blocker deficiency. We don't have allergies because we have an Allegra deficiency. We don't have migraines because we have an Imitrex deficiency. Now, sure, those things can help mitigate some symptoms, from time to time. But the idea is let's get underneath that, figure out why those effects are happening in the first place. Then you don't really have to treat effects anymore, or certainly not as often. You're actually correcting the cause, and then effects take care of themselves. And it really is. I mean, it's the most brilliant way to live your life, because that's how you get the best results instead of waiting till the house burns down. So we're excited about it. Very good. All right. Well, I'm going to open it up for any other questions. We've got about 2 minutes left. So if there are any other questions, please raise your digital hand. If there aren't any, no problem at all. And Dr. Sarver, any closing remarks, anything you'd like our viewers and listeners to walk away with today so they can leave better than when they showed up?
Yeah, so two of the most common things are energy, sleep, and those go hand in hand. And we also see a lot of folks that want to just have that better digestive function. Digestion is really, really core. About 80% of our immune system is within the digestive tract. So a lot of times what shows up in the exam will not be in a lot of patients' mind's eye what they think they need to have handled first. But the unique thing about this testing is that it gets to the priority. So it might be digestion first. It might be something totally different than what I think it will be for that patient. But invariably, if we follow the path that the testing provides us, we get there. We get to the cause. And that's the most important aspect.
I love it. It's all about the correction of cause. Well, I really appreciate your time. Drive safely. Thank you for being out here in Ann Arbor this morning. And we look forward to the continued great life-changing results. By the way, how long have you been doing this work?
I've been in nutrition for almost 27 years now.
That's longer than anybody that comes in here has been alive, man. No?
Thank you.
No, I'm teasing, but that's awesome that you have experience like that. That's great. And thank you for serving in Ann Arbor. Thank you for serving in Flat Rock. Thank you for serving in Grand Rapids. We have one more question before we sign off. And the question was, what do programs of treatment consist of? That's a great question. People want to know that. So you get them tested, right? And then what? What do you, how do you help them once they've tested?
Well, typically what we're doing is we're looking and seeing how long the problem's been there, how severe the problem is, and then we design a program, usually depending on the patient, but generally speaking, the average is a year to make sure that we're really honed in, and the frequency of the visits really depends on that patient as well. So the frequency varies, but what we're looking at is less and less frequency. Typically after they've been working with me for several months or a year, we're down to several weeks or months. And then the supplements that we provide for them in the office are not over-the-counter supplements that they're going to buy at the health food store. So we're getting things that we know are very high quality, things that we have tested directly on them to work with their body's physiology. So we know that what I'm doing isn't going to be dumbed down by a product that sounds the same, but it isn't the same.
Makes sense. And last question. Patients tell me all the time, hey, I saw on this website, or I saw this article, or I was watching ABC News, and they said that I need zinc, and I need vitamin B12, and I need vitamin D, and that echinacea is good for my immune system, and that I need omega-3s, and that I need adrenal support. So I went to Whole Foods and I talked to Jimmy, who just graduated high school. He's a really nice kid. and he got me some really good quality supplements that I bought, and I'm gonna just take all those. I'm gonna start that way instead of having somebody test me out or see what my body might need. What do you say to that person?
Well, number one, I like to encourage them that at least they're thinking natural, but usually they're wasting their money, and I hate to say that, but to prove it to them, I will have them bring a supplement or two that they think is going to help them. And we check them against what their body says about it. And a lot of times, even though it says natural or organic, etc., the exact formulation is not what their body tests for. Even some of the most expensive, exotic, high-priced brand sources, it really, really depends on what their body wants and needs for fixing the cause. A lot of times what they're doing is they're overwhelming their system with too much zinc or too much calcium, etc. So, some of these things actually, you can form kidney stones or different maladies with doing too much of a good thing. So I like the attitude that they want to get healthy and well with natural, but I really throw up a big red flag and put any real blessing on that other than really getting the specific testing to see what they need at that time and then going forward.
Makes perfect sense. We're of the belief that excellence honors God and inspires people. And so we believe that if we're going to do something, we should do it well. And I actually have experienced in the long run, when we do it right from the beginning, it actually, most importantly, gets better results. But secondly, it actually does save time, energy, and money in the long run because nobody's trying anything. Everything is tested and dosed and improved and specific. This care has to be specific or it's nothing. And so this is really good. Well, Dr. Sarver, thank you so much. Great working with you. And to our live viewers, thank you for being here. Thanks for the great questions. I know that's really going to help a lot of people. And we'll see you back in the office on Monday. Have a great rest of your week.
Thank you.
All right. Thanks.